No two thumbprints are similar. This is the same when it comes to the journey through cancer care. As the world observed Cancer Day with the theme United by Unique, we are taking a look at what makes cancer care treatment differs from one person to another. Good evening. Welcome to Sound Health on Lagos Television. I am Olasumbo Mutbe. The conversation begins after this break.
The program is a 3-year program and it involves training of health workers, providing mosquito nets and nutrients for malnourished children. We have also supplied equipment to primary health centers, as well as providing media information to the public. We believe that healthy mothers will produce healthy children and our nation will also be healthy.
Let's talk about nutrition in pregnancy and nutrition in children under 5. What is nutrition in pregnancy? Nutrition is everything that a woman needs for the growth of a baby. And it comes with diets. With proper diet, a child is expected to grow well in her womb. And then that as the child is growing. For a child that is growing, a lot is going, and then a proper meal has to be produced for that child to grow properly. A child needs breastfed first 1 hour of birth, and this is called early initiation. During this period, that child has the advantage of taking the first milk that comes out, that is called colostrum. That's acting as the first immunization for the child. It happens for the first 1 week. Every child is expected to be breastfed for the first 6 months exclusively without adding anything, no water, no drugs. And also, proper breastfeeding also help with easy expulsion of placenta and proper evolution of the uterus. After 6 months, there's a iron gap, and that's why we actually also advocate for proper complementary feed with continuous breastfeeding till the child is 2 years. And in breastfeeding, it is important to note that there are 2 kinds of milk, fore milk and hind milk. And if a child does not enjoy both milk, that child looks as if he's not well fed. So the timing of breastfeeding has to be long enough for a child to be able to benefit from both the fore milk and the hind milk. Any child that has been breastfed for the first 6 months exclusively is expected to continue breastfeeding and have complementary food, and that is family meal. The proper and appropriate complementary food must have adequate diet. It must be available, accessible, affordable, and what is advocated is the food around the community that the child can join with the family meal for that child to have proper growth. A proper diet gives a proper growth, and a proper growth is a healthy future.
The program is still Sound Health on Lagos Television. Join us via Zoom this evening to take a look at personalized care for cancer treatment, as well as what the journey looks like for different persons. As they say, different strokes for different folks. Is Dr. Temitope Olatunji Agumbiade. She is a consultant, clinical and radiation oncologist with the Lagos State University Teaching Hospital. Good evening, Dr. Olatunji Agumbiade, and thanks for joining us.
Thank you for having me on your program today. It's always a pleasure joining your Sound Health to impact knowledge. Thank you.
Dr. Olatunji Agumbiade, the theme for the World Cancer Day is United by Unique. What does this mean for Nigerian patients?
So this theme of United by Unique impact patients, particularly in Nigeria, by advocating for personalized, person-centered care that addresses their specific needs, their individual needs, rather than just the disease. It's an international day marked on 4th February to raise awareness of cancer and to encourage prevention, early detection, and treatment of cancers, basically. So this year's theme is United by Unique, and this has been a theme since 2025, and it will still be the theme up to 2027. This emphasizes the fact that while cancer journeys are diverse, individuals are united in fighting for a better personalized and equitable care. It focuses on placing people at the center of cancer care, recognizing the fact that every individual's experience is unique. and at the same time, while uniting to reduce the global burden of this disease. Everybody deserves a good care, a people-centered care, basically. I mean, you have to individualize treatment, not just a one-size-fits-all. Treatment is tailored, all right, to address specific individuals' needs in terms of the physical, emotional, and social needs. Moving beyond this, all right, tangible actions that improve cancer care access and outcome from everyone are done regardless of location or background. So, I mean, everybody deserves an individualized treatment. Everybody deserves to be united, because I mean, cancer diagnosis hits differently, right? So this campaign basically emphasizes that behind every cancer diagnosis is a unique story involving grief, pain, resilience, and hope, particularly for everyone globally.
From your experience, are we seeing more cases due to better diagnosis or just as a result of our lifestyles?
Yes, we're beginning to see more cases of cancer. I will attribute this to our lifestyle factors, and talking about obesity, excessive alcohol intake, smoking, poor diet. I mean, talking about diet, they're high in processed foods, increased exposure to environment toxins, smoking, pollutants, microplastics, um, improved early detection. Now people are more aware that cancer is a reality, not like in way back where if you mention cancer, people will be looking like it's an abstract topic, that where is it coming from. So people are now more aware, because as a result of all the awareness that is ongoing on social media and everywhere, NGOs are doing better awareness, and now we even have more diagnostic tools to detect cancer, even not just even cancer, even the immunohistochemistry. I mean, we couldn't do it in Nigeria way back, but now pathologists can do this investigation. So I think this has also contributed to the high incidence of diagnosis that we're seeing.
What are the top most common three cancers, and are they the same for men and women?
So the top three most common cancer are lung CA, breast cancer, colorectal cancer. They differ in both sexes. In female, the commonest is breast cancer, followed by lung cancers and colorectal cancer. So in male, the commonest cancer in terms of the highest is prostate cancer. This is followed by lungs and bronchial CA, then followed by colorectal cancer.
Experts always say early detection saves life. How early is early? And what are the signs we need to start looking out for?
Yes, I will say it over and over again that early detection saves lives. If we're able to catch these diseases early, in their pre-malignant states, or even in the early stages like stage 1, I mean, there will always be a better treatment outcome and a good quality of life. Okay, so, and how do we get to do this? It means catching those diseases in their pre-symptomatic state by actually going for regular screening, going for pap smears, so just in case there is cervical cancer, or you catch it in the pre-malignant state, all right, where there's just few abnormalities in the cells of the cervix. Once you catch it, you'll be able to tackle it on time. Talking about colonoscopy, fecal occult blood test, okay, regular breast scanning, viral markers, blood works over and over again. So if we're able to catch these diseases in their early states, I'm sure that, or in their precancerous states, there will be a better outcome. Or even, okay, when the disease is established, if it's a localized disease, you catch it there before it becomes metastatic, there will be a better outcome and there will be an improvement in the quality of life.
Nigeria and as well as all over the world, there is a huge stigma that says once you are diagnosed of cancer, it is a death sentence. How true is this, and how do we start changing the narrative?
All right, so cancer diagnosis is not an automatic death sentence. It depends on the stage at presentation, which is why we always encourage people to go for screening. And if you go for screening and we're able to catch the disease at a pre-symptomatic or early stage, oh wow, fantastic, we can achieve cure. But if this patient presents at a later stage, say stage 3, stage 4, even stage 3, we can still downstage to stage 2 or thereabout. If patient present at stage 4 when the disease is already metastatic, you know that the treatment outcome will not be fantastic. At stage 4, we cannot cure the disease. But early stages or localized stage, say early stages, stage 1, 2, but even if at the localized stage like stage 3, we can still manage to cure depending on also the histopathological type, the grade of the disease, and all that. So it's not a death sentence. I need to correct that notion, but everybody knows that with the diagnosis of cancer, there's a whole lot attributed to it. There's a whole lot in terms of emotion, in terms of work, family, the dynamics completely changes. But quite frankly, it's not a death sentence if we catch this disease early.
Most people seek alternative care and they come to the hospital when it is too late. How do you balance between both?
Yes, unfortunately, most people go about seeking alternative remedies first, and by the time they present, they come back, the disease is already advanced. So it's rather unfortunate that the situation is like that. But how do we overcome this? We can overcome this by regular awareness. We should do more awareness online, social media, television awareness. Even all those lectures that we're doing, I'm sure this will reach our rural people, the people in the rural areas. Education is key. There is actually no excuse for ignorance. Herbal medication cannot cure cancer, so it is what it is. We'll catch it early. If you catch it early, come to the hospital. It does not mean that it is death sentence. It is not a death sentence. So we'll try to encourage these our people, and I know a lot is also ongoing where we have meetings with stakeholders, market leaders, and all that. So I think this will also improve the awareness. This will help spread the gist that when these situations arises, it's best to go to hospitals, and early presentation at the hospital saves lives and also improves the treatment outcome and quality of life.
Are there resources, access to care for people who are actually living below the pocket line, especially those that cannot afford surgery, chemotherapy, or brachytherapy?
Yeah, for individuals that are unable to afford their medical treatment, there are some resources available in Lagos and across Nigeria. The latest one is the Ilera Eko by Lashman, the Lagos State Health Management Agency. It's a social health insurance scheme where patients are able to receive treatment at a well subsidized rate. We have the primary healthcare centers, which are usually first point of contact. We have other agencies like the Alafia Eko. Then we have the NGOs. Particularly, I know we have some NGOs that support our patients in oncology. We've seen people step forward to do chemotherapy, sponsor chemotherapy, maybe even it's 4 sessions or thereabout. There are even some religious bodies that come across, or even some notable people in the society that come forward to help our patients that really cannot afford treatment. But in all, there are resources available in Lagos where people are currently being helped. All right. So all these non-profitable organizations too. There are some NGOs I would not want to just mention their name, but they've really been good to our oncology patients. They step forward to help our patients. I can confidently say, Cancer Aware, I mean, they've been there for us. They sort our patients out. There are quite a number of them. So there is basically help. I know we've had some patients that have been sponsored for surgery, some for their chemotherapy, some radiotherapy, and some of these health insurance schemes, they still cover certain percentages, if not all, of their treatments for chemo, for radiotherapy, and surgery too.
All right, now, Dr. Temitope Olagunjo Agunbiade, let's clear some myths and misconceptions about cancer. Is it true that sugar feeds cancer?
There is no direct evidence that consuming sugar makes cancer to grow or spread, or that avoiding it as well stabs cancer cell. However, we know that high sugar intake causes obesity, which is also a known risk factor for cancer. All right, so it's always better to maintain a balanced diet rich in vegetables, fruits, and whole grains, rather than fully just focusing on just eliminating sugar. So maintaining a good lifestyle, good weight, good diet will help.
How can we support people diagnosed of cancer and so they won't look as if they are a victim or they are overwhelmed?
Supporting our patients without overwhelming them or making them feel like they're victims, I mean, includes active listening. We have to be able to allow them to vent without immediately offering solution. You acknowledge their feelings of frustration or their sadness or anger without dismissing them. We have to keep in mind that they're human. First, see them as human before seeing them as a patient. We have to be able to maintain their dignity, their identity, treat them as a person with a condition rather than a victim of a disease. We should validate their feelings, their experience, and also keep an open mind with them, and while also trying to support them, be specific, we respect their no's, we ask before giving them their advice and keep it as casual as possible, but not withholding the truth from them as well.
All right, if you could tell viewers at home one major thing they can embrace to lower their risk of cancer, then what are you going to share with them?
In order to lower our risk of having cancers, the modifiable risk factors that we have power over. I'm not talking about the non-modifiable, which you don't have any power over. Talking about the age, the sex, you don't have any, or genetic disposition, we don't have any power over that. So, but the ones that we have power over, talking about the modifiable risk factors, which includes tobacco intake. So, avoidance of tobacco intake or tobacco products, alcohol intake, maintaining a healthy weight and diet. Taking a balanced diets that are rich in vegetables, in fruits, and fibers. Physical activity, basically, not living a sedentary life. Reduction of exposure to sunlight, ultraviolet. In terms of all the skin cancers and all that. Then vaccination for us, for our children. Getting vaccinated with hepatitis B antiviral vaccine, rather, human papilloma virus, regular screening and all that. So going for colonoscopies, going for mammograms, they will help us. And limitation of further environmental exposures and all that. So this will limit our risk of having cancers. And quite frankly, I can never say it enough that early detection saves lives. So regular screening, we should go for a screening. I will continue to say this at every opportunity that I have. All these factors will reduce our risk of having cancers. Thank you.
To be diagnosed with cancer is not a death sentence. Seek help early enough. Dr. Temitope Olagunje Agunbi, a clinical radiation oncologist with LASUTH. Thank you so much for your time and expertise on the fight against cancer.
Oh, thank you for having me on your program. It's been a pleasure sharing knowledge and giving insightful informations. Thank you so very much. Till we meet again. Thank you.
Sound Health continues with trending health report from around the world. Please stay tuned. Program is still Sound Health on Lagos Television. Go for that checkup. Invest in your health care just as you invest in businesses. Do not take your health for granted. Whether you're a caregiver, a person living with cancer, or a family supporting someone living with cancer, you are not alone. Embrace yourself. Reach out for support. Seek help early enough. This is where we say thank you on today's episode of Sound Health. For comments and inquiries, or you have topics you'd like us to treat, please send SMS to 0035826603 or follow us on social media at Lagos Television #Sound Health. A sound health is a sound mind. Make healthy living your choice.